Because of Dr. Deuk, I'm not existing, I'm living. And I haven't lived for a very long time. My back would start hurting so bad right here at the base that I would have to just quit, take a rest, and then I'd go back to doing the dishes again. Now, I've done the dishes the last week or so, and no issues. No Tylenol, no Motrin, no nothing. About 25 years ago, I was working for a company and I was moving what I thought was a light object, which was a battery backup for a computer. So I bent down and I twisted, and then when I stood up, I felt my back give out. By that night, I'm in the emergency room, extreme pain. They're pumping me full of drugs to keep me messed up, sent me home with a bottle of pills and basically said, well, that's what we can do for you. So after a couple of weeks, I found a massage therapist slash acupuncturist who took my pain from a level 10 down to about a 5. And since that time, for the last 20 years or so, that's been my normal, a sharp pain of 5 with just a dull ache in my back. And I just figured I would have to accept that. If I carried too many groceries or turned a funny way or bent over to pick something up, I'd get shooting pains, take me up to 10, and I'd be taking all kinds of Motrin and aspirin and all kinds of things, trying to just take the edge off, just get it down a little bit. And acupuncture always proved to be the best one, but it only got me back to what I would say is a lifestyle of an 80-year-old. That's literally what I felt like. The ache was always there. I didn't feel like doing anything. My stomach was upset because I was taking all these pills for the pain. I was surviving or walking through life, I don't know, waiting on what I didn't know. I couldn't exercise, and just as I aged, I just got heavier and the back was hurting more and more, and it was truly just, it wears you down. It takes away all your drive to do everything. So a few months ago, I was waived from a contract with Hewlett-Packard Corporation, and I had some time on my hands. I thought once and for all, based on the advances in technology that I've been seeing on television, maybe it's time to take a look at it. So I engaged the services of a health system out of Tampa that we came up with a plan, and I did MRIs and CAT scans and sent them over there, and we had the whole thing set up. It would have to take me away from home for about a week, so I'd have a week's of hotel stay. I'd have visits every day before and post-op. I got sick on the day I was supposed to drive to Tampa, and I also had to make crazy arrangements for people to drive me to the surgery center and back and be with me, so some of my family was going to have to kick in and miss work as well. I guess you could say luckily I got sick with a sinus infection and couldn't go. And at that point I pretty much gave up, because I thought I have to get a job, I have to go back to work, and I can't go to work and then automatically just take a week or two off of work to try to recover from back surgery, so I gave up on it. One day I'm sitting there on the internet doing some work. I don't remember the details of it, but I tripped across this website for the Deuk Spine Institute, and they were in Vieira, which when I had looked the last time and selected the company out of Tampa, I didn't find anything local. I don't know if I put the search term in differently this time or what, but I was elated because I already had all the patient profile information, the CAT scans, everything preliminary that needed to be done. So when I met with Dr. Deuk and his staff and we reviewed all the information, he scheduled me for one more set of tests and said he'd be able to zing me right on through the process. So from the time I contacted them until I had surgery was a week. I got up off the operating room table or the recovery room table, put a brace on my back, which is just to keep from re-injuring it, and it forces you to use proper body mechanics. I walked out of there I took regular Tylenol for pain for the first few days, and it's still tender to the touch, but my range of motion has increased to the point where I can put my own socks on now, I can clip my toenails, something I couldn't even dream of doing before, because after a few minutes of trying to stretch forward, I would just be in so much pain it wasn't worth it. So this has been like getting your 30s back or something. I mean, I really felt old, like a retired person, because I was just walking through waiting to die. The fact that I don't wake up with that dull, aching, throbbing pain every morning when you open your eyes, I can't tell you what that does for your attitude. So for me, a 54-year-old man who was really walking around like an 84-year-old man, I'm 40. For someone that's endured pain for long periods of time, you don't realize how it can just wear you down to nothing, and that rips your quality of life apart. So for me, this is like a miracle. I never imagined that it would be this dramatic. I thought maybe I'd experience some relief and be happy. Now I'm just starting a new job based out of doing software support out of my home, where I have to sit for many hours per day. But between the back brace and the proper posture, I sat for 8 hours today through classes. I'm invigorated to the point where I'm putting resumes out for kinds of jobs that I stopped looking for years ago. Maybe get my career back as opposed to a job. It's like a second chance at life.